Hey everybody, we've got another heart today. This is number 143 in our collection, and we'll start off with a quick teaser or trailer of the pertinent phenotypic features of this heart, and then go through the rest of the anatomy. So I'll go ahead and open the heart here. Here is the right ventricle, and immediately you'll appreciate that there is, in fact, what appears to be an inlet perimembranous ventricular septal defect here. And what I want to point out about this, and what will be the topic of a few related videos, is that the tricuspid valve here appears to be both overriding and straddling. So what do those words actually mean? So if a valve is overriding a defect, that does mean that the overriding means that the valve annulus itself is over the defect. So here is the crest of the ventricular septum here, and let me try to open that up a little better. So here is the crest of the ventricular septum here, and you can see here is the annulus of the tricuspid valve, and it certainly goes over and across this ventricular septum here. What was the putative ventricular septum? Right, so this is a tricuspid valve that is in fact overriding. And then when we look at the cords, we can see there actually is some of these cords that go to the right ventricle, and that means it is a straddling valve as well. So straddling meaning that some of the cords cross the defect and go to the other ventricle. So here from the left ventricular aspect, we can see here is that VSD, and then here is the tricuspid valve, and you can see that the tricuspid valve does override this defect, and it straddles here as well, as we can see that this cord goes to the left ventricular septal surface. So a tricuspid valve that is both straddling and overriding. Now let's just go and orient ourselves to the heart and see the rest of its features. The heart would have sat in the chest like this, anterior surface towards the screen, posterior towards the turntable, head or superior here, legs are inferior here, left over here, right over here. We'll start off by identifying, at least externally, what appears to be the right atrial appendage. And here is what seems to at least externally be the right atrial appendage. It's triangular, it's broad-based, it's pyramidal in shape. So we'll go ahead and open up the heart there. And when we do that, we do see that there's pectinate muscles that spill outside the confines of the appendage, consistent with a morphologic right atrium. Here is the oval fossa, which appears intact. There doesn't appear to be an oval fossa type atrial septal defect. Here is the mouth of the coronary sinus. Let me try to demonstrate that a little better for you. All right, let's see. Here is the mouth of the coronary sinus right there. And that is guarded by this Thebesian valve right here. And then the mouth of the coronary sinus, the tendon of Todera, which is right here, and the right-sided atrioventricular junction form a triangle. This triangle is known as the triangle of Koch, and at its apex is where we would expect to find the atrioventricular node. So we would expect the AV node in this heart to sit approximately right here. Now, before we move on to the other portions of this heart, I do also want to demonstrate the superior caval vein, which we can see externally here, which comes and drains into the roof of the right atrium. So this is the opening of the superior caval vein into the roof of the right atrium. Now we come to the right-sided atrioventricular junction. And we see that it's guarded by a valve that has 3 leaflets, 1, 2, 3. And we see that this valve does in fact have direct septal connections consistent with a morphologic tricuspid valve. So this would be the anterosuperior leaflet, this would be the septal leaflet, and then this would be the inferior leaflet here. Now we appreciate this ventricular septal defect that's quite large here. And once again, we can see that the tricuspid valve is in fact overriding this defect. Sorry about that. that this tricuspid valve is overriding the defect. Here's the crest of the ventricular septum, and you can see that the annulus actually sneaks over the crest and into the left ventricle. And here is the orifice of the tricuspid valve here, and once again, here is the crest of the ventricular septum. And we can see that there's cords of this tricuspid valve that go through the defect over into the left ventricular aspect, which makes this straddling. So overriding means that the valve annulus overrides the defect, and then straddling meaning that the cords go through the defect. Here is a ventricle with coarse trabeculations. There is a septomarginal trabeculation, all consistent with a morphologic right ventricle. As we get into the right ventricular outflow tract now, we find an arterial valve right here that has 3 leaflets. This heart's being particularly sneaky and slippery. So here is an arterial valve with 3 leaflets, 1, 2, 3, and this is just the other part of the leaflet here. You can see that this valve is entirely supported by muscle. There's no fibrous continuity with anything else. And this is all consistent with a morphologic pulmonary valve. As always, I want to note that unlike the atrioventricular valves, the arterial valves don't actually have a true round or oval annulus. That's not to say that this human-made structure or construct isn't helpful in surgical planning or interventional planning. It's just to say that it isn't a true anatomic structure. The real annulus here is actually this crown-shaped or semi-lunar shape, because you can see that the fibrous valvular leaflets are actually kind of these half circles, and they're these interleaflet triangles that interpose in between the valve leaflets. Here is the pulmonary trunk, and that's been transected. That would have given rise to the branch pulmonary arteries. And now we'll flip the heart over and go to the posterior aspect of the heart. And here we can see the left atrial appendage now, arguably one of the cutest structures in the heart. We'll go ahead and open the second atrium. And here is the orifice or the mouth of that left atrial appendage, which you can see is finger-like and a vastly different shape than the right atrial appendage. Now, here we see that this atrium has a very smooth vestibule. It's very smooth walled. All the pectinate muscles live within the confines of the left atrial appendage itself, all consistent with a left atrium. Here is the flap valve of the oval fossa, and then here are the horns of the oval fossa. Then we come across the left-sided atrioventricular junction. This is guarded by an atrioventricular valve here that appears to have 2 leaflets, one here and one here. And this valve does not have any direct connections to the ventricular septum, consistent with a morphologic mitral valve. So here is the anterior leaflet of the mitral valve, and here is the posterior leaflet of the mitral valve, and you can see that these 2 leaflets are not similar in size, which is in fact usually the case. We can see the papillary muscles here and here as well. And when we look at this ventricle that it opens up into, we find fine crisscross trabeculations consistent with the morphologic left ventricle. Here is that ventricular septal defect now. We see it from the left side. We have seen it from there before. Here is the tricuspid valve. We do see that the annulus, part of it right here, is in fact overriding the crest of the ventricular septum here. Overriding means that the annulus actually crosses over into the other ventricle. And then the tricuspid valve also straddles this defect as the cords actually, some of them, connect to the left ventricle. So here is a cord of the tricuspid valve that is actually connected to the septal surface of the left ventricle, making this tricuspid valve both overriding and straddling. Then we get into the left ventricular outflow tract here. Here's a second arterial valve. Once again, note that the semicircle fibrous valvular leaflets have these triangles, these interleaflet triangles interposed in them, so the arterial valves do not have a round or truly oval-shaped annulus. And this is all consistent with a morphologic aortic valve. And we can see within the sinuses, there is in fact one of the coronary arteries arising right here. Let me try to demonstrate that better. Here's the orifice of one of the coronary arteries arising from this aortic sinus here. And here's one leaflet, two leaflets, three sinuses of this arterial valve as well. And you can see, unlike the pulmonary valve, there is some fibrous continuity between the aortic valve and the mitral valve here. So here's the anterior leaflet of the mitral valve, here's the aortic valve here, and part of it is in fibrous continuity with the mitral valve. And once again, we can actually see the tricuspid valve here as well, which we know is both overriding and straddling this ventricular septal defect. Here's the ascending aorta here, here's the transverse arch here, and then the descending aorta has been transected, and then we see some of the head and neck vessels here. So a heart with a inlet, perimembranous ventricular septal defect with a overriding and straddling tricuspid valve.